So we have Dr. Gaurang with us, coming from Maharashtra,
Mumbai.
Mumbai.
Yeah.
So we're going to ask you about OAB. So the very first question is going to be for our viewers that according to you, what is an overactive bladder? Very simple question.
When the
Yeah.
bladder muscles contracts, when they are not required to contract.
Okay.
So when you want to pass urine and your bladder contracts, is a normal phenomenon.
Yes.
But in between when it contracts and you have got urge to go and pass urine, that is overactive bladder.
Okay. So when it comes to OAB, how does it impact the quality of life of a patient?
Number one, we
Yeah.
start from the night. So if person has to go more than 2, 3, 4 times in the night, his or her sleep will be affected.
Yeah.
Next day performance will be affected.
Yes.
Right? The same thing happens during the daytime. If you are doing some job or you are doing your work and in between if you have to keep on going, so that is an early stage. A later stage, before you reach to your toilet, okay, a person will pass urine. Now because of that, the social effect is there. Patient will stop meeting friends, family members, because the smell of urine is always there. So the quality of life is affected because of that.
Well, there are cases when a patient says that when I laugh or when I sneeze, I leak urine. So
Yeah.
is this a case of OAB or not?
This is called stress urinary incontinence. In stress urinary incontinence, there is laxity of muscles. So when there is an increased intra-abdominal pressure, when you laugh, when you cough, or when you sneeze,
Yeah.
or sometime when you change your posture,
Okay.
so there is increased pressure in your abdomen, and this pressure is ultimately transmitted to the bladder. So when the bladder gets compression, normally our muscles they close so that urine doesn't leak. But in such cases, it cannot close properly and the urine will leak.
Is it a matter of concern?
Yes, again the same thing. Na?
Same thing, yeah. When it comes to that same topic, what are the cons of a delayed diagnosis when it comes to the patient? Can you also recall one of your patient with whom you got such sort of thing where there was a case of OAB and you rectified it?
There are many cases like that.
Any
But the most important, I will say, is the one social worker. She was very active and helping and working for an NGO, and she had this problem, and because of that, she refused to go out from the house, and ultimately her husband came to us, and he said that, can you help us? And when we treated her by medicine, and in case of this stress urinary incontinence, we did a surgery. Now again, she is doing lots of social work. So there are many cases like that, but this is one of the cases where she used to do lots of social work for children.
Now
the
she's
children
back
are
on track.
Yeah, she is back on track.
Wonderful, wonderful. But what role does behavioral therapy plays in treatment of an OAB? Would you like
In
to say
early stages, yes.
Yeah.
See, every patient, because of this OAB or stress urinary incontinence, it will not be causing any life-threatening condition.
Yeah.
It is basically a social problem rather than medical problem. It is not going to take away your life, or it is not going to affect your life, but the quality of life is is affected. So whenever we treat overactive bladder, okay, patient is very grateful to us.
Is it related to the age or it can happen to anyone? Any?
Usually young people, they don't get
Okay.
overactive bladder, but it
Okay.
can be. We have seen that many people, when they are in stress, the overactive bladder, because ultimately the brain, in our body there are two types of muscles.
Okay.
One muscle is called voluntary, second is called involuntary. Voluntary muscles is like your hand muscles, leg muscles, which are under your control.
Yes.
Involuntary is like your heart and your bladder. So bladder is also involuntary muscle. But the brain over the period has taken the charge of that, and you are able to control. Okay. So if something goes wrong, again voluntary may become involuntary muscles.
Okay.
So the brain has got lots of
Wonderful.
function in this.
Well, what is your advice to an individual with an OAB trying to lead a normal social life?
Very simple. If it is a very early stage, you can restrict fluid whenever you're going out. Stop aerated drinks, caffeine. Do Kegel exercise. That is, tightening of your vaginal muscles
Yes.
and your rectal muscles and the sphincter around your this thing. The most important thing in overactive bladder is meditation.
Okay.
If you do meditation, if you relax your body, if you relax your mind, it has got best effect on your muscles.
Wonderful, wonderful. Thank you so much, sir, for being
Thank
here.
you.
It was
Thank you
very
for
amazing talking to
yeah.
you.